Well, maybe now would be a time to move on and talk a little bit about the experience that we've all had collectively around the country. Some wonderful efforts have gone into pooling experience between different centers, and I know that at least twice, once first in 2007, and then more recently, an international effort in 2018, pulled together experts or people who spend a lot of time thinking about and treating children with spinal muscular atrophy to pool their experience. The one thing that I think we can all agree on is that a multidisciplinary approach with people who have expertise in different areas really benefits these children. Because although it appears that the motor neurons take the biggest hit, and therefore weakness is the biggest single problem that the children with spinal muscular atrophy have, it's very, very clear that weakness affects the different organ systems differently. So as it affects the bulbar muscles, that affects issues of swallow and speaking, and as it affects the respiratory muscles, then we have the whole issue of adequate ventilation and need for pulmonology support. But it's a very complex thing. I think that you were very involved in this, Basil.
Yes, I remember that there was a meeting on IH back in 2005, 2006. And that was the time when there was a lot of energy going into SMA research and the development of therapeutics for SMA. And we realized that for many years we were following patients without actually having any standards of care. And a decision was made during that meeting to develop standards of care by having meetings and conference calls to discuss the different aspects of care and trying to come to a consensus as far as standards of care for SMA are concerned. So that led, as you said, to a publication in 2007 in the Journal of Child Neurology. And for many years we try to follow the standards of care, although I have to say that there are probably many centers around the country or around the world which maybe they did not follow the standards of care very, very strictly, but at least was a guideline to allow physicians taking care of kids with SMA to try to address some of those aspects of care. With the development of therapeutics, the so-called supportive care became even more aggressive, and given that we're expecting these patients to live longer, and things have changed over time. For example, surgical procedures for the correction of scoliosis have changed, and I think pulmonary care has become more aggressive. So it became clear around 2015, 2016 that we had actually to revisit the issue of standards of care, which led to a workshop in Europe by the European Neuromuscular Center, which led to, again, the development of new standards of care, I would say updated standards of care for SMA. And this led to the publication, in fact, of 2 papers in neuromuscular disorders in 2018, which describe the discussions around the standard of care, which is multidisciplinary, as you said.
And I think one of the things that's helpful to remember is that not only are these consensus standards helpful for providing good care for the children with spinal muscular atrophy, but it creates more of a level playing field. Because if we're going to have the children be entered with this rare disorder into treatment trials, it's going to be very helpful to have them have similar kinds of support over time, so that they're more similar than not as they approach this. I could recall very distinctly at some of the families of SMA meetings the recognition that good nutrition for some of the animal models could not serve as a placebo because it actually influenced the outcome. And both animal models, and then as we revisited this back with the children, making sure that they had good nutrition was something that affected their well-being in a very major way. But obviously, so we clearly have as part of the standards of care the concept that nutrition, whatever it takes to make sure that the children are growing reasonably and have good nutrition is important, but also all the kind of standards of pediatric care that are reasonable, including vaccinations and other preventive measures, make a big difference.